Hi, I'm Eric, SBT. Wanted to talk to you about ACL injuries and what impacts those injuries and affects them. So, neuromuscular deficits, and basically what neuromuscular deficits are, is any type of weakness, usually in the muscle or the nerves that are corresponding to those muscles. And in the hip and the trunk, have seen that with those deficits, that it does lead to a more susceptible chance of having an ACL injury. And this is usually due to what's called dynamic knee valgus. And what valgus is having your knees cave inward. And to kind of test this and go forward to see if there actually is an impact with this happening is to test for lumbar spine joint rotational stiffness, as well as the glute musculature to see if the hip also has joint rotational stiffness. And that stiffness is basically leading to certain kinds of ailments that would happen with those injuries. And those injuries leave you more susceptible if you're high valgus, which is having your knees really cave in, as opposed to low valgus, which is having your knees more parallel or running out.
Hey guys, my name is Selena, and today I'm going to talk a little bit about who the participants were in the study. So this study took 18 college-age women from a group of volunteers. And these volunteers had to have no current or previous injuries and no chronic pain in the lower back and lower body. These participants came from recreational or varsity teams from sports like volleyball, soccer, rugby, martial arts, or basketball. And these types of sports are common for ACL injuries, which is an injury in the ligament of the knee. These participants also had to sign a consent form provided by their university to participate in this study. So now I'm going to let Sydney take over and kind of walk you through what was done and the activities that were performed in the study.
The subjects that Selena mentioned performed a drop vertical jump, where the subject jumped off a box, landed, then jumped off both feet. These subjects are classified into 3 different groups based on the level of valgus in their knee, which is how much their knee is knock-kneed, or going towards the midline of the body. The first group was bilateral valgus, where both knees are very knock-kneed. The second group was unilateral valgus, where one knee is very knock-kneed. And then the last group was no valgus, where neither knee had any valgus. And the different stages of the standard drop vertical jump, it started from a 31 centimeter box where participants began with feet shoulder width apart and toes at the edge of the box. The participant initiates the movement by dropping off with both feet off the box, then landing each foot on the ground, and then performing a maximal vertical jump up in the air and then landing back down on the ground with both feet.
Hi, my name is Justin, student physical therapist. The outcomes of this study showed that contracting the muscles of the hip, such as the glutes and the hamstrings, during the landing phase contributed to less knee valgus. Accordingly, when the spine was vertical upon landing rather than horizontal, there was also less values of valgus. Looking at some of the measurements taken from this study, we can see that medial knee displacement, also known as knee valgus or knock knees, which is associated with risk of ACL injury. Medial knee displacement increased when there were higher levels of lower spine flexion. Accordingly, when the muscles of the lower spine and glute were contracted more, there was less medial knee displacement. So this means there was less chance of injury.
Based on the results of the study, the ACL underwent a lot more stress during knee flexion during a knock knee. So when we put our knees into that knock knee situation, that causes a lot more stress. That can be interpreted based on how we land, how we absorb a step, where this will cause more stress on that ACL. And that's also partially due to the lack of trunk engagement. So whenever we go into that knee flexion, if we don't engage up here and all this motion comes from the knee, if we add a genuine valgus force or knock knee, it's going to cause a lot more stress than if we were to engage our trunk and hips. It would be easier on that. And there would be less of a knock knee effect because of our glutes working and our trunk also helping stabilize our body.
Hello, my name is Alex, and I'll be discussing exercise programs that will prevent injury during jumping and landing activities. Exercises that strengthen the thigh and hip musculature are very optimal towards preventing knee injury during jumping and landing exercises. Prescribing 4 sets of squats at 8 reps per set is a good start towards building proper lower extremity balance by strengthening the anterior thigh muscles that stabilize the knee. Additionally, standing hamstring curls should be prescribed to minimize any quadricep to hamstring muscle imbalances. This exercise can be performed with 3 sets of 10 reps per set and a 5-second hold for each rep. Lastly, the buttocks muscles are also important to strengthen in order to prevent ACL injury during competition. This is because these group of muscles work to prevent an athlete's knees from caving inwards during the landing phase of a jump. Performing a clamshell exercise is a solid foundation towards promoting strength in the gluteus maximus. To perform this exercise, you will want to lay on one side of your body with your legs pressed together and your knees slightly bent. While keeping the heels of your feet together, you'll want to rotate your top leg up about half a foot, then slowly rotate that same leg back down to its starting position. You'll want to perform this exercise with 3 sets of 8 reps per set.